As a finance professional in a disrupted business landscape, what does it take to be in demand? What does it take to attract great paying international roles? If you're an ICAN member, it'll just take one exam. That's all it takes to complete the globally recognized SEMA professional qualification and the internationally respected CGMA designation. As a SEMA member and a CGMA designation holder, employers will look at you as a finance professional, constantly acquiring new skills to add value to the business. That's why they'll be willing to pay premium to hire and retain you. If you have 5 years of relevant experience and are an ICAN member, you can directly sit for the final exam of the SEMA Professional Qualification, the Strategic Case Study exam. Start studying the SEMA Professional Qualification. Prepare to make an impact.
Good evening, our colleagues, friends and students of the Institute of Chartered Accountants of Nigeria. It is my pleasure once again to welcome you to another episode of ICAN on Air, your program, our program, like I usually say, powered by a noble institute, ICAN. Today, you'll be having double host. Myself, Tosin Akimomi, and Fumi Olaniyi will be anchoring today's edition. So inform your colleagues and friends that the show has started, and you can be part of this show, ICAN on Air, today on ICAN Facebook page, Instagram handle, or ICAN YouTube channel. And today, Thursday, 18th May, year 2023, we shall be considering another contemporary topic, health management and challenges, what professionals should know. And I have here with me an erudite speaker, a professional health manager, and a vibrant speaker, Dr. Fechi Nkwoch, who shall be providing insights on the topic. As you all know, professionals should watch their health level and health status, and all about health and health issues will be brought down to you today. So sit down and relax as we bring this program to your desk today. I'll be right back after this time out. Don't go away. You are welcome once again to ICAN on Air. Like I've mentioned, and we have in the house Dr. Fechi Grace Nkwoch, and we shall be looking at a topic today: health management and challenges. What professionals should know. You will agree with me that everything about accountants should not just be accounting and accounting. We should also go and look at our health status and be able to understand what we do not know regarding our health. I have the honor to welcome to the studio Dr. Fechi Nkwoch. You are welcome, madam.
Good evening. Thank you for having me. Thank you, Mr. Tosin.
You're welcome. You're welcome. Thank you very much. Let me quickly talk to our audience about your profile so that they can know that our guest today is actually an erudite health manager. And when you talk about health, we should be listening to you regarding your discussions on health. Dr. Fechi Grace owns a Bachelor of Dental Surgery, BDS, from University of Lagos between 1999 and 2006. And she also attended West Africa College of Surgeons in April 2008. And also in April 2012, she held a Part 1 fellowship in Orthodontics and Part 2 fellowship in Orthodontics in 2018, October in 2018. She has held several certificate courses regarding health management courses, and as such, our profile is one that our audience this day will actually want to listen to you. So let's start this way, our doctor. You know, we as professional accountants, we are accountants. And basically, we go on our business to do all regarding our own areas of profession. Either we are auditors or tax consultants, or we are external auditors or internal auditors, or control managers, or whichever way we find ourselves. But however, today we have brought you in to speak on major areas which concerns our health. And now I also want to now mention to you things that we have been noticing, things that are prevalent regarding health management, particularly in this part of the world, that people do not know. So let's start this way. Health, they say, is wealth, and life can only be enjoyed by the living. I'm sure you agree with me on that.
I do.
Hello, madam.
I do, sir.
Okay. So our topic for today is not only important to our global audience, but to all mortals across the world. And you being our guest for today, we want to share from your wealth of knowledge and experience. And we actually appreciate you getting some knowledge in this area. So what is health management? And kindly run us through the types of health management that we have out there, doctor.
Thank you, Mr. Olumide. Thank you, ICAN on Air, for having me. I am always delighted to be around chartered accountants. And truly, health is wealth, especially when you are with the accountants. Thank you once again this evening, Sam. I want to start this way by just giving a broad overview of what the terminology health management means to any healthcare professional. And what I mean by healthcare professional, anybody who is working in the health sector, and accountants are key members of that health sector. So generally, I would say health management is the planning. When medical people talk about health management, okay, we're talking about the planning, administration, and management of healthcare systems. So it's really broad. It involves managing the manpower involved in the health sector. It involves managing the materials that are useful for us in the health system. And it also involves managing the time that we have available for all of this to function. But I want to break it down to such a way that it will be useful to everybody, not just accountants, not just people working there, doctors, nurses, technicians, ambulance people, mortuary people. All of us need to work together to be healthy, first of all, to offer our patients, our clients, health. So different people play a role. The government plays a role. The individual plays a role. And the communities. When we talk about communities, like ICAN is a community of intellectuals, a community of people who understand finances, people who understand that prevention of problems is better and cheaper than cure. So that's where I would like. So what I would like to talk about today is what the individual and communities can do to improve health generally. And I'll also base my talk this evening that on the fact that all health is not medicine. All health is not medicine. So as an accountant, you will agree with me that sometimes you think you are depressed, but just what you need is a credit alert. Some people who have added that a credit alert should be added as a form of therapy. So what am I trying to say? Health management as a whole, involving the challenges that can occur in terms of manpower, materials, and the minutes. I want to talk about the role that we as individuals can play and as a community. And we're going to be talking about not drugs now, not surgeries, but the lifestyle choices that we make, the choices we make every day that influence the health and influence health outcomes. Can I go on?
You can go on, doctor, or you can go on, doctor. However, there are lots of questions being sent in by people for you, so that I just pray you can answer all those questions. But go on, but make it brief as brief as possible.
Okay, so I'll start out by making healthy choices in every facet of our life. So first one I would like to talk about is our food. Now, there's this saying that's what we are, what we eat. And if that is true, then it means that if we choose healthy foods, then we're going to be healthy individuals and healthy communities. And then you ask me, what is healthy food? Is it these organic foods? Is it those things that they say we should eat without fertilizer? How do we know what we eat? How do we know what is organic or not? How do we know what is healthy or not? Certain times when we go out to buy food, do we look at the environment of where we're buying the food? We all like suya. And many times suya is prepared at the roadside, many times near a gutter. We like roasted corn. Many times it is being sold by an open gutter. That choice to buy those foods that may have been infected, may have been contaminated, is yours. You can decide to buy foods from vendors who package their food in a healthy and in such a manner that it would not be contaminated.
Correct.
Where do we source our fruits from? Our meats, where do they come from? There are certain things that our governments can do to make sure that food vendors and people who handle our foods do it in a wholesome way. There are certain practices that food vendors and food merchants engage in that the government needs to come in to check those practices. I'll give you an example. I don't use the example of meat because I'm talking on the topic of food. I'll go on to other things like our roads, our jobs, and certain choices we need to make concerning those. Since I'm talking about food, do you know that there are some butchers or some abattoirs we get to? They actually beat this, they kill the animals, and immediately kill the animals, they beat these animals so that they can swell up and appear big. However, that practice causes that animal to emit certain hormones that are toxic, that are not good for human consumption, because once that animal is dead, in the first 1 to 3 minutes, it could
Okay. Dr.
You could
Grace.
still, I'm here. You could still
Dr.
emit
Grace.
those hormones.
Okay.
So
Okay. Please.
our government could come in.
Permit me to interject. Permit me to interject. Like I did mention, there are lots of questions that are coming in, and we will appreciate that those questions are being taken such that our audience can actually be engaged on regarding their questions. So we'll come back to those discussions on food, on roads, and other areas where you're actually talking to. Now, before I come to Fumi, I have a question here. As a health practitioner, there is this assertion or claim that despite one's high level of education and exposure, many professionals are generally careless when it comes to taking care of their health or managing their health. What's your take on this?
Well, we have seen individuals who make choices, and I'm going back to choices, that are not a reflection of their education, of their level of education. And I was going to touch on those areas. So let me quickly run through them. I've talked about the food and the fact that we need to make better choices when choosing our sources of food. And I want to talk about road, but I'll come back to that one. Then let me talk about yearly checkups. And that is where this assertion comes in. Now, as accountants, we know that prevention is easier and cheaper than cure. But many times we put away those symptoms that come up. We say, oh, I've been having this pain in this area, but well, I'll manage. We ask our clients, we ask our patients to visit a doctor at least once a year for a yearly checkup. For example, let me use the simple example of high blood pressure that leads to a stroke. It doesn't develop within 30 minutes. One who has high blood pressure, if he sees a doctor twice a year or once a year, it will be detected. Many times they'll be placed on medications. Many times they'll be given lifestyle changes to undertake. And that would make sure that we don't have people developing strokes, because managing a stroke is more expensive than managing just high blood pressure. So to manage high blood pressure, one may be asked to take a tablet of medicine that costs maybe 800 naira for a month. But taking care of a patient who has stroke may involve selling a building. So that brings me back to the materials, the challenges we have with materials in the healthcare industry. We are living in a society, in a resource-starved, resource-poor economy. So we should be thinking about doing things that are cheaper for our health. That's why I talked about food, making good choices with food, making choices that involve yearly checkup. There are problems that people encounter along the way. They say, oh, we will go to the hospital, the queues are too long, the cost is too much. There are things one can do to mitigate that. We have the health management organizations, we have the HMOs, we have NHIS, we have the different states health insurance agencies. We can key into those platforms to make sure we have access to healthcare. Then we have individuals who prefer to consult non-medical professionals and religious houses and different things. We have this saying that many times when somebody needs a health issue, they go to different places. They go to their friends, they ask their mother-in-law, they ask their in-laws, they go to all manner of places. Only when it comes complicated do they come to a doctor. And you have a lot of mistrust and distrust going on. And by the time the person is coming to the professionals, there's little or nothing that can be done. And I'll use the situation of cancers as an example. So you have people who you tell, oh, this is what we're seeing. We're seeing a stage 1 or stage 2 cancer. And we say, oh, it's not my portion, it's not my this, it's not my that. You go fast, pray, and do all manner of things. And even some of those houses, those babalawos and people they go to, charge them exorbitant fees. So by the time they are getting to the hospital, they are impoverished, they are emotionally flat, and the disease has gone beyond what any orthodox medical practitioner can handle. Okay. And find out that the person may not be an uneducated person. Okay. But it's a trend that we see every day in our hospitals.
Okay. Thank you very much, Doctor, for that good response to that question. Fumi, what do you have for Doctor today? Well, I'm sure you are loaded with questions. So,
Dr. Fechi, thank you so much for being here today. I've learned so much in this little time that you have spoken, and I would say we are very grateful for having you. It's not just about the academics, right? We need to take care of our health, and health is wealth, but a lot of people go after the wealth and ignore their health. So we're so grateful. You know, one thing that is most fascinating for me is how people were able to manage the pressure, the stress, the shocks of ill health, of families, of friends, even jobs. You know, there are lots of things about the jobs. We can't even talk about everything now because we would exhaust our time. You know, a lot of people are facing shocks and stresses, even at work. And, you know, most times in the medical term, they say stress can be a friend or a foe. And, you know, as our professional colleagues are listening, we also would like to understand or to better understand what we can qualify as a stress and what we can qualify as the foe in terms of our health. And I want to drive home a point in you know, Nigeria and the world in general face the pandemic. And that pandemic, perhaps it brought up a lot of people in their homes. Perhaps it brought about opportunities for business to thrive, but it was different for a lot of people. Depression set in. So what would you say is how we can manage our health so that we don't face this friend or foe, as you call it in your professional world?
Thank you for me so much for that question. Friend or foe? What friend or foe means is that, let me start with friend. Imagine, for me, look at your leg, there's a snake. All right, that's a stressor. Okay, and the emotions, the hormones that will be released at that moment to help you escape from a snake bite. That's the friend. All right, that's the friend. It helps to make sure that you protect yourself. But remember, the moment you find yourself, you've jumped out of the room, you're now safe. You hit if you put your hand on your chest, you will find that your heart is beating. Okay, but it's short-lived. It doesn't happen every day. It doesn't happen all through the day. It doesn't happen for years on end. So that's what the stress we call the friend is, because you actually need some stressors and sometimes to motivate you to do certain things in all areas of life. Okay. Now, when we talk about chronic stress as an enemy, all right, or as the foe, it now means, for me, there's a snake living on your leg. So that you're running from the snake is pursuing you around the house all the day. You will run. After some time, the person would flat out. All right. So the pressures, the stressors that are supposed to be there to help you achieve a task momentarily, and then you continue, on your normal course of action. However, what are the things that can stress us? Stress comes from the workplace, stress comes from the family, stress comes from our lifestyle, our lifestyle activities, our lifestyle and the activities that we engage in all the time. How does one identify stress? How do you know when that house girl is beginning to stress you? How do you know when that employee is beginning to stress you? How do you know when that deadline is beginning to stress you? Sometimes you need that deadline to meet up, to get that paper published. You need to get that done so that you can get the next promotion, and it's a good thing. But when you begin to think about that deadline and you are scared, when you begin to think about that deadline and you feel like vanishing, that means there's a stressor. When you begin to run away from activities that you enjoy normally, activities that you ordinarily would have looked forward to, that's a stressor. So if you're coming back home and say, oh, I'm going home to meet those people again, they are doing something wrong. If you're going to the workplace and you remember that, I'm going to work again, my God, I wish I could go somewhere else. We need to identify those activities, sometimes individuals, sometimes desires that are stressing us. So for example, one may be under the impression that he has to buy a Bugatti before the end of the year. Is that a realistic goal for you? If it is not a realistic goal for you, then you need to recalibrate so as not to place undue burden on yourself, undue stress on yourself. Set realistic targets for yourself. Plan activities ahead. All right? It's not every event you should say yes to. And I have come to realize that as our bodies get older, our brain doesn't agree that it is old. So we take on a lot of activities and wear ourselves out, and you find out that even dressing up for that Owambe is a drag. You need to identify the things that you can do, and at each time, plan ahead. Any activity that you were not invited for on time, you can decide to opt out. Take time to rest. Sometimes going to rest may just be you going to a park, just a quiet place, sitting down and watching people walk around. Just take some time off. Many people, I've come to realize, don't take leaves for leave's sake. That's a reason why the leaves were incorporated as part of the work plan. It helps you draw back a bit like an arrow, go back a little so that you can shoot further when you come back to rejuvenate. Take time out and sharpen yourself and improve yourself. Depression, according to our mental health colleagues, have made us to realize that it's one of the medical illnesses that can be treated without medication, provided you identify the stressors, provided you get it right, you are identified on time, provided you identify the stressors, provided you do whatever is necessary to remove those stressors from your life, you'll find out that one can actually bounce back.
Wow. Wow. I think I've learned so much from all that you have taught us today. There are little things that we take for granted, including not being able to say no, even to a supervisor. So now that Dr. Fechi has told us that is one of the stressors, we must be able to say no. So Tosi, take note of that.
Duly noted.
So Tosi said, "Put me, please." I said, "You know what? Dr. Fechi has already instructed me to learn to say no." So
I'm sure you won't do that.
Very interesting. I guess we
Sorry,
need to go
let
on
me interject here.
Okay.
For a supervisor, you wouldn't be saying no for a planned activity. You know what you're supposed to perform every time. It's only when you leave jobs undone that you can begins to irritate the people you are working with. So planning, that's why I talked about planning your activities, planning your day. You're supposed to be in the office by 8 o'clock. Then you should have left home by 6:37. If you leave at 7:45, you'll be late.
Sure. Thank you very much. Thank you. Yeah. Okay, so viewers at home and viewers across the diaspora, you've been listening to Dr. Fechi Nkwoch, and particularly on health management, what professionals need to know. And I'm sure gradually we are following as she's dissecting and resolving our questions. But quickly, let's go on the break, and we'll be right back to take many of your questions after this time out. Don't go away. We'll be right back. Yes, so welcome back to our program, ICAN on Air. And if you are just joining us, today is a special program. And we have in-house Dr. Fechi Nkwoch, who has been talking to us on health management, what professionals need to know. And myself, Tosin Akinwumi and Fumi Olani here, we are both anchoring this edition of the program. Why? Because it is not an academic topic. It is an essential program about our health, and health is wealth, they say. So, Doctor, we'll take your questions. Just keep sending those questions in. Certainly, we'll have time to quickly take those questions. So let's go this route, Doctor. In line with the philosophy of health management in general, so what are the qualities or attributes of a good health manager? You have mentioned different people, in-laws, babalawos, and other. But now, for a good health manager, what can you say are the qualities or the attributes for we should watch out for?
Okay, so I still won't use the term health manager, because I told you that this topic, health management, as it is in medical terms, is very broad. It's talking about the whole healthcare system, and there are different players in there: the doctors, the nurses, the lab attendants, everybody, accountants, everybody in that system are managers of some sort. So if we're now going to be talking about different people who treat patients, right? That's what you want me to talk about, right? Different people who treat patients. Let's start from our mommies. Our mothers are our first doctors, and that is why we like to educate them. We always talk to them during antenatal visits. I'll try to look at the first people who reach people in the very first stages of life. Our mothers. They learn first aid. They learn how to safely take care of a child. and eventually they become some sort of doctor or nurse. And then, so the people in the family contribute to the health education of a child and to other members of that family. And they are very important because they are the people that we talk to first. Oh, mommy, my head is aching me. Mommy, I have pain in my arms. As a parent, as a mother or father, you should know some first aid. And you should also be able to identify when it is time to take the child to a hospital. Now, I would always talk about the hospital because that is where I am trained. That is where I know how best to serve people. But I have come to realize that a lot of people do not have faith in our hospitals. So they would have gone to other places and other places and other places. But I like I said earlier, many times they claim to give some form of natural remedy or some form of quote unquote Chinese remedy. I don't know about them. Many times they are not published. Many times their side effects are not known. Many times the mortality, the people who they treat wrong or they don't treat properly, do not live to tell the story. Many times, even our patients shield them. Do not want us to know about them. And they come to the hospital only when things are bad. Now, in the hospital, we have the different healthcare professionals working together to make sure that our patient gets the best of care, playing different roles. We have the doctors, we have the nurses, we have the health information managers. That's the people who keep our records. And, with technology, all of this is advancing. You have the clinic managers, you have the pharmacists, you have the technicians in different areas that make sure they assist the professionals. I'm talking about the Orthodox healthcare institution. Those are the managers, those are the players in this institution. You want to ask some questions? I'm here.
Yes, I mean, I was so happy that you have made everyone understand the role of mothers, because we seem to administer all of these drugs even without being doctors, right? But we look at the prescription, and thank you for mentioning that there's a limit to it. If you've gotten to the point where the child or whoever has to go to the clinic, please do so. And we've seen a lot of questions coming in, and Tosi, permit me to read out some of them. So David Obashua Femi, he said, as professional accountants, how do we manage our health stress level? I think Dr. Fechi has said a lot, but perhaps we should just let her put in some light on this question.
Okay. Thank you, Fumi. So, Mr. David, how do we manage our health as our stress level as accountants? Yes, as accountants, I know you are faced with a lot of stress, a lot of deadlines to meet and all that. So, I said planning is very important. Planning your activities, planning your day, setting out on time, and learning to delegate certain roles and responsibilities. You have to work with people, isn't it? You have to train people and train them in such a way that they can perform certain activities to a trusted, to a high level, to assist you in your work, to assist you to do your work faster and more efficiently. When you notice that you have a lot of pressure on yourself, you can take a leave. You can take a 1-week leave to rejuvenate and come back. You find out that you're able to do some of those things faster and properly. And I've talked about delegation, and yes, I think that's, and then let me quickly put this in here. Routine medical checks, routine medical checkups, sometimes we have medical issues going on in the background that we may not know about. Recently, I heard of a colleague who escorted his wife for a check, and the people at the facility said, "Okay, sir, why don't we just look at you?" And they did it. They walk up, and someone said, "There's something happening here. Let's take a look at the heart again." And they did a scan, and he had a blood clot waiting to be dislodged. And a blood clot dislodging doesn't really give one time, to even get to the hospital. That's why you hear things like someone slumped and died. And that's usually many times there may not be any symptom. But he had the opportunity. But anyone who doesn't avail him or his or herself that opportunity to go for a routine, you don't have to wait until the pain or disease or that stops. I am a dentist, and I know that culture of waiting until things get so bad is worse even for dental conditions and dental complaints. Okay, so these three at least: making sure you plan your activities, plan your job, take leave from time to time to rejuvenate with people that matter to you, your friends, your family, and sharpen your skills, and make sure you engage in your routine medical checkups. Okay.
Thank you.
I think with this,
in fact, when you were mentioning food, take care of yourself, all of that. I just saw the question. Tosin, can you relate? The question on the screen, right?
Exactly, I can. Go ahead, take it.
Yeah, the person that's Ouma NS Chuku Naru is saying a great philosopher once posited, "Man, let thy food be thy medicine." Man, how can food be your medicine if with the failing economic indicators, especially the skyrocketing food prices? I mean, can doctor respond to that?
I started talking about food in the beginning, and it seemed like I'm the only one who liked food, but somebody else has talked about food, and I talked about food. I was talking about healthy choices. Okay. There was someone recently we're talking about that takes for breakfast 1 loaf of bread and soft drink. For lunch, he will take soft drink and fufu. And for dinner, he will take rice and another pack of soft drink. Now, everything in this life is good, but moderation is the key. We talk about balanced diets. What does that mean? It means eating different categories of food, different classes of food in the right proportion every day. Yes, the prices of food are in the sky, but as accountants, you can also have a garden. And nowadays we're talking about people growing food around them. You can grow your greens in bags. You can grow ugu upstairs in your balcony. I've done it once. And make sure that with every plate of food is garnished with vegetables. You don't have to buy every food. If you have any space around your compound, you can grow certain things. You can buy some soil and put in a bag and grow your vegetables. Yes, you can get proteins. If you cannot afford beef, buy egg. Make sure you have proteins in your food. Don't just take bread and cook. Break bread and cook lunch, bread and cook dinner. Even the ones, that coke is 150 naira. It's like 150 naira. Egg is like 50 naira. You can buy you 3 eggs that will last, one for breakfast, one for lunch, one for dinner. So it's the choices we're talking about. Okay, and we can, like I talked about, grow some of our vegetables. You can grow lettuce from the one you buy from the store. When you buy lettuce, you cut off the lettuce leaves And the stalk, you put it inside an empty bottled water container with some soil and leave it by the kitchen window or in the balcony behind the kitchen. You can line them up there and you have your lettuce. You can eat yam with it. So all those different classes of food, protein, carbohydrates, the fats, and the minerals, water, all those need to be taken every time in the right proportion.
Interesting.
That's a good one. Yeah. That's a good one. That's a good one. Thank you very much, Doctor. We are enjoying, and I can see comments from our audience regarding this program and regarding the way you are responding to their questions. Another question from Fatbola Tebitokwe Adeni, irregular participants on this program. So educate us more on the effect of exposure to radiation and computer to everyday working accountants and its impact on our healthy living.
Okay, thank you. When medical people hear about radiation, and you said radiation, we are expecting, or we think about the rays from machines, some heavy machines such as X-rays, X-ray machines, the big X-ray machines. Now, those are the ones that we know that are dangerous, that are not fit for human beings to be around every day. Of course, there are some heat, there are some things that are emitted from our computers, light, and all that. But I do not know at this moment of any hazard from just being around a computer. Now, these are computers have been improved on over the years, and they have to pass standards before they can be released into the market. So for harmful radiation, I do not think so. I'll still go and take a look at it, but I don't think just being in front of a computer can expose you to the type of radiation or the harmful radiation that people who work in uranium factories or people who work in X-ray rooms and people who work in other radiotherapy sections are exposed to. No, it's not the same level. However, the light from the screen sometimes have been said to affect people's eyes and all that. There are also things you can do about it. There are glasses that have been said to help to reduce the glare. We call it glare from the computer. And if you feel at any point in time that your eyesight or the computer is affecting you, don't wait until you can no longer see the letters on the screen. Get to see an ophthalmologist. Get to see request to see an eye doctor. They will examine you. It may not even be the screen that is causing the problem. The ophthalmologist will tell us that the biggest thief of eyesight is glaucoma. Glaucoma is excess pressure in the eye. It's so much pressure that the nerve that feeds the brain from the eye is damaged. And that occurs over a long time. And many times there's no symptom. You just wake up one day and say, what happened? I'm opening my eyes, I can't see on the left. I can't see on the left. So that's why I go back again to a yearly routine check.
Okay. But let me just I have a follow-up question on Fagbola's question regarding the radiation. If I can relate, there is this little amount of what we could call, maybe we could call it smoke that has been emitted from the computer, and when you put it on your leg, and you hear people saying that don't put computers on the leg because there's a form of heat being emitted from the system. So if I can relate, maybe that's what he's trying to say. I'm calling it radiation. Is that harmful in any way, doctor?
Heat is harmful. Heat Heat is harmful. I'm using a computer in front of me, and I'm using a laptop, and it's on the table. Yes, it is called a laptop, but the best position for it is not on your lap. I appreciate the question, people, especially coming from our male colleagues who have to use laptops and prefer to keep it on their laps. Of course, it's a mechanical device, it's an electrical device. There's some form of energy, heat energy being emitted from under it. And with the keeping the laptop on the laps, you'll be transmitting that heat from the laptop onto the skin around the lap. And that will be in very close proximity with the scrotum. Okay, and you have the male genitalia, which is responsible for reproduction, lying in that area. The main reason it is outside the body is because it should be kept cool. Inside our body is hot. Have you ever had your own urine fall on your skin before? You wonder if someone poured hot water on you. So nature decided to keep the testicles outside the body. Now we don't carry laptop and put on top of it from morning to night.
It's a working from home something.
Buy table. Those are the choices we're talking about. Buy table. Keep it on the table.
Everybody buy
Allow
it.
me to breathe.
Okay.
And I saw a comment when someone said, if you say no to your supervisor, you are on your own. So I read that comment, and because we don't have too much time on our side, I'll just like to ask a question. ICAN is always open to ideas that would actually positively and advance the growth of its members. And, for accountants, we care about our environment. We care about as much as we care about money, right? What is your advice, or what suggestion would you give us on collaborations for health trainings to sensitize and to improve the well-being of our members in Nigeria and even in the diaspora?
Thank you, Fumi, for that brilliant question. In fact, it would be wrapping up, from where I started from. Now, I started by saying all health is not medicine. And in fact, most of the things we've talked about this evening, I didn't talk about any drug, I didn't talk about paracetamol, I didn't talk about any antibiotic. Whatever accountants can do to make sure their environment is safe and is safe. Safety is equal to health. I ended up not talking about the roads, but then I'll just quickly chip it in now. As an accountant, it is cheaper not to run red lights. It's cheaper to obey road signs and speed limits, because the consequences of not doing this will cost the accountant and not just the accountant, the public money, and it will stretch the already thin healthcare facilities that we have. In terms of collaborations, to make sure that accountants have access to healthcare services, to healthcare facilities, you can embrace the National Health Insurance Scheme and other managed care facilities, like the HMOs, like the state-owned health insurance agencies, and utilize them. Many times we leave our dental, not just dental, yes, I've got to talk about dental too, because dental is even worse. If people neglect health like this, you imagine what they do about their oral health. People allow their health insurance to waste. It's easier and faster for you to walk into for a general checkup, for a routine medical check, than to wait until one is actually sick. So you can't, as a community, buy health insurance. You can, as a community, even buy accident insurance. You can, as a community, buy life insurance. So those are ways you can make use of the strength of your numbers.
Okay. Thank you so much. I would say we've had more than one app with you. It seems like we've had a whole year to learn all of these things. And I saw questions around eggs. There are lots of questions that people really want answers to. Our health is important and we must prioritize on our health. So at this junction, we would like to say thank you so much to our doctor in the house. In fact, she did wonderfully well on this subject matter of our health management and the challenges. What will professionals know, or what we should know? So Dr. Fechi, Grace, Nkwoch will say, on behalf of Tosin and I would like to say thank you. And on behalf of the Institute, we would like to say thank you so much. And we hope that the next time we call you, you'll definitely answer our call.
Thank you. Thank you so much for having me. God bless you.
Thank you very much, Dr. Grace.
Much.
Thank you, sir.
So, Tosi, I guess we've had a wild day today, and it's just sad to say goodbye, but definitely we have some information that our colleagues should know about. We have the fellowship conferment ceremony of the Institute coming up on the 20th of May. It's on Saturday. It's at All Seasons Plaza, Ikeja. And then, Tosi, the other events that the Institute has on schedule on Monday and Tuesday?
Yes, on Tuesday or on May 22nd too, there will be public presentation of the ICAN Accountability Index reports for year 2020 and 2021 assessment years. So members are also to follow this event. It is a virtual event and the link will be sent to all members. And finally from here, on Wednesday, 24th May 2023, there is a special general meeting of ICAN members. Special general meeting of ICAN members coming up at ICAN Center, plot 12, Kovokasumo Street, Lakeview Estate, Amuwo Dofin, 11 a.m. Please, let's all ensure we attend this meeting. And I think that will be all for now.
I just want to make one more. Remember the Monday, the Tuesday event. So we have the 71st induction ceremony of new members coming up 22nd and 23rd of May at the ICAN Center, Amuwo Dofin. We all like to see new faces. So thank you so much for being a part of this program today. Tosi, I can only blow you kisses. Thank you so much for making this program a wonderful one. And I will say thank you to all the directors, everyone behind the scenes. And what we can say is have yourself a great evening and take care of your health.
Thank you very much. Bye for now. Have a lovely evening.
Good evening.